Good afternoon, everyone. I'm Governor John Carney. It's January the 5th, 2021. Welcome to the new year. It's great to be in 2021. Good riddance to 2020, certainly the worst year of my lifetime, and I know many others. The good news is we've survived 2020 thanks to so many Delawareans who followed the guidance and the restrictions, thanks to the support that we got from the federal government. Our congressional delegation with the CARES Act funding $1 billion that was provided to individuals in unemployment assistance and rental assistance and small business assistance, in testing and contact tracing on public health side, funding that went directly to our schools, to child care facilities, to hospitals and first responders. Just an incredible effort by all Delawareans. I'm joined today by two of the folks that have been at the point on the public health side with Dr. Karyl Rattay, Director of Public Health. Thank you, Dr. Rattay, for your work and that of your team. Dr. Susan Bunting, who's the Secretary of Education. Thank you, Dr. Bunting, for your work in getting school children back into classrooms, getting school children fed and their families over the summertime, protecting children and staff and educators, and to all our teachers and staff that have come up big over the last 9-10 months with remote learning, hybrid learning, in-person instruction, helping the children that need it the most with their educational needs. And to all of our first responders, our hospital partners out there. We were on the line yesterday with the hospitals, again, doing tremendous work as they meet and treat patients today, meeting that post-holiday surge from Thanksgiving and the expected increase that we're going to see in hospitalizations from the Christmas, New Year's celebrations. Hopefully, we have our fingers crossed that it won't be as bad as it could be, as people got together, let their guard down a little bit, and involved in celebrations. We are really focused on two things as we approach the new year. Again, the good news is that the vaccines have arrived here in our state. 50,000 or thereabouts are being distributed through our system of focus on healthcare workers, hospital workers first, physicians, nurses, first responders, paramedics, law enforcement officers, nurses, all the folks in that 1A category. It's going to take us some time as we ramp up, and we'll have a lot of discussion about that today and this afternoon, and trying to address some of the questions that we have. We had a good phone call yesterday and today with our hospital partners as they are getting their vaccinations out to their first line healthcare workers in the hospitals, nurses and personnel that deal with patients on a hand-to-hand, day-to-day basis, physicians and their partners in the community. So we're delighted to have both. Our two focuses now are, one is bringing our children back in schools. One of the things that we've learned over the last 9-10 months is that schools are among the safest places in our community. We have not seen measurable community spread in the school systems themselves. They're safer than other places in the community. And most of the communities we spread in places where people gather socially, in private homes, and events that occur outside of structured environments. And it's an area that we don't have a lot of control over, other than our constant messaging for individuals to be careful in your own home, when other households, to avoid mixing other households in with your own, wear masks when that occurs, and certainly in public to wear masks and keep social distancing so that we can meet the surge of cases. We're going to see in a minute that hospitalization number that is most concerning to us has kind of stabilized a little bit. We're in kind of a waiting period right now in the early days of the new year to see what kind of impact the holiday celebrations will have on new positive cases, on the percent of tests that are administered that are positive. We passed that $1 million mark, million test mark for the number of tests that were administered, and obviously continuing to see too high a number of positive cases on a day-to-day basis. So I want to thank everybody who's been part of our effort over the last 9-10 months in meeting the challenge of COVID-19. We've been doing it along with governors and our friends and neighbors in the region, Pennsylvania, New Jersey, Maryland, Connecticut, Washington, D.C., up in the Middle Atlantic region and into New England and down to the southeastern states. We have been following the science from the CDC and the White House Task Force, and we'll continue to do that, trying to balance that with the needs of the strength of our economy. We have to have both, obviously, as I've been saying like a broken record now for 8 months. You can't have a strong economy without a healthy community, and you can't have a healthy community without a strong economy. And so we've been attempting to strike that balance to enable economic activity, to allow our small businesses, particularly in hospitality, to be able to do business and do it safely, protect their customers and their staff, and to flatten the curve on new cases and in particular hospitalization. So we're focused now getting children back in the classrooms and making sure that the vaccines that we're receiving from the federal government are getting put in the arms of Delawareans with those first responders, hospital workers, and healthcare workers in that first 1A category. So let's take a look at the data. Already now we're looking at over 60,000 total positive cases, going back to our first positive case in early March. Sadly, nearly 1,000 lives lost. We all took the opportunity at the end of the year to mourn the loss of our neighbors and family members and those who died alone, frankly, and those who died without the support of their loved ones under the COVID-19 conditions and situations. And everyone a precious life and justifies the efforts that we put forward to protect the most vulnerable among us, our neighbors and our family members. Hospitalizations, as I said, is a big concern of ours. We'll show you in a minute the run-up we had from about 100 in the hospitals to now 431 as of yesterday. We did peak out about a week ago at over 450, and hopefully we'll be able to flatten that out and not have another surge upward as a result of Christmas and New Year's. Obviously, with 56 of those that are hospitalized, critical of some concern. We do have additional and more effective treatment available in the hospitals and for people to prevent hospitalization. Monoclonal antibodies have proven to be very effective in treating folks if they get it early, particularly those 65 and older, and are recommended that you contact your physician if you're in that category and you're feeling those symptoms. So let's look at the positive cases in Newcastle County. 35,000 cases in Newcastle County, almost 10,000 positive cases now in Kent County. We've seen a run up in southern Newcastle County and Kent County over the last several weeks, and 16,000 positive cases in Sussex County. Have flattened out a little bit in Sussex County. Still some areas of concern. The hospitalization rate, as we talked to the hospitals yesterday, at a high level, but fairly stable. At the moment, they're actually seeing more patients with other conditions than COVID-19 that have tested their emergency rooms. So our percent positives are still really at an unacceptably high level. The one that we're really focused on is the percent of the tests that are positive, right around 10% now. We want to actually be below 5%, and we've been below 10%, around 9% over the last several weeks. That means at the current rate of testing, about 700 new cases per day. Again, a level that's really unacceptable. We've done, as I said earlier, we've passed the 1 million test mark. We've tested more than 1 million people, or more than 1 million tests that are administered to just over 500,000 people, so many people getting tested for a second, third, and fourth time. And that's frankly a good and positive thing as you manage your exposure to the virus and whether that you are shedding the virus and contagious to others. You can see the rate of positive cases by age group. Again, that the young adult two demographics leading the way at the top level there, 18 to 34-year-olds and 35 to 49-year-olds. And our message continues to be careful, particularly in social environments, in environments where you're bringing others outside of your household into your home for social gathering, to have pizza and beer and watch a ball game or something. Just be very careful about that. Try to avoid that, frankly, when you can. Let's take a look at the 14-day view of the data dashboards. You can see current hospitalizations have leveled out there in the 430 range, peaking out of 454 a little over a week ago. Hospital admissions, again, tend to jump around. We are hearing from the hospitals that they're able to move patients in and out of the hospital a little bit faster than in the spring, their experience in the spring, as a result of better treatment methods and other things to they're able to do. On the top right, far right is the number of new positive cases, again, at a very high and unacceptable level, over 700 today. And then the two graphs in the middle and the far left on the bottom is the percent of tests that are positive there in the middle. Again, at a too high level of 10% positive. We'd like to be under 5%. And then the last graph there is the emergency department visits for flu-like, COVID-19-like symptoms. And you can see the surge back in the spring in March and April, and then this current surge that we're seeing in emergency rooms as well. If you take all the available data going back to the beginning of our data in April, you can see that current hospitalizations, the top row, the far left, where you had the peak there at the end of April, I think April 27th to be exact, and then a run up in hospitalizations starting in early December after the Thanksgiving holidays. Again, surges that we're seeing in states across the country, really the result of social gatherings outside of controlled environments and folks that are in public gatherings where they're not wearing masks and keeping appropriate social distancing. You can see the run up in positive cases on the top far right, much higher than back in the spring, mostly because of the incredibly greater number of testing that we're doing today. We had a goal of 80,000 tests per month. We're well over 1 million. We're well over 100,000 tests per month over the last couple months. And as a result, you can see with high percent positives, you're going to identify more positive cases, and that's what you're seeing in that graph. On the two graphs on the bottom, the center and left, that shows you the percent positive of those tests, and of course the graph is smaller for the number of tests because you've got so many more tests that are being that are in that denominator. So when we look at the data dashboard for personal protective equipment, we're in good shape there with respect to gowns, glasses, goggles, masks, surgical masks, face shields, gloves. Everything's in pretty good shape there. Here's a look from back in April and May until today, the graphs of the hospitalization numbers. You can see in the spring, we went from 167 on April the 9th to 337 on April the 17th, a very steep 1 month rise in those hospitalizations. And then we hit a low in mid-August at 29. So we went all the way from 337 to 29 as the curve was flattened. We got people outside. social distancing, a lot of shutdowns to achieve that. And then as we moved into the fall, particularly after Halloween and Thanksgiving, we saw this run up in December, November and December, from 107 hospitalizations on November the 2nd to 306, 3 times almost, just in a month from November to December, and then another 150 or thereabouts to the December peak just before Christmas. Our hope and our prayer now is that we don't see an additional surge on top of this. You can see things flattening out there for a number of days, and our hope is that that will continue. We don't know that that's going to be the case, and we might have a continued spike up as a result of the positive cases that result from the Christmas, New Year's holiday. So our focus is squarely on getting the vaccine in the arms of Delawareans and getting as much of the vaccine that we get, getting every dose that we get from the federal government out to vulnerable populations and critical and essential workers in that first group, which will occupy so much of our time with our hospital partners and our physician group partners, pharmacies, nursing homes through the month of January. Lots of other populations that are in that 1A group that are part of that. I know there's some question around when their time will come. We hope to get to that time as quickly as possible, get to vaccinating our educators, because that's our second really goal into the new year. And we're urging with a letter that went out today, every district to make every effort to return to hybrid learning on Monday, January the 11th. We took a pause 2 weeks before Christmas and the preceding the Christmas holiday break, a week, almost 2 weeks after Christmas, to meet with teachers and educators across our state, to meet with school superintendents, to address data concerns, and really to demonstrate what every governor and every public health agency in the country and around the world knows, which is that schools are safer places, among the safest in our community. And given the incredibly important role of educating and task of educating particularly our youngest children, those learning to read, those with special educational challenges, we really need to lean into this effort to get as many children in front of teachers in classrooms starting on the 11th. We've gone and shared the information that you're going to hear about from Dr. Rattay and Dr. Bunting with respect to our effort to do this. We will be there with you arm in arm, addressing the concerns as they arise, making sure we're on top of any outbreaks that we see. We have not seen many. There's a great study that Dr. Rattay is going to talk about from Mississippi that talks about the spread in certain venues outside of schools, and then that compares it to the potential for spread in schools, and there's just a vast difference there. Every other governor that I talk to in our region and across the country has this as a primary objective, and it's ours as well. So getting vaccines into the arms of Delawareans and getting children in front of teachers in classrooms are really our high priorities as we move into the new year. The new year, 2021, is going to be way better. Can't be any worse than 2020 with the COVID-19 pandemic, a situation that none of us have experienced in our lifetime. We have fought the fight. We have beat the virus down once. We're fighting to beat it down a second time. We know so much more than we did. We've tested, administered over 1 million tests and prepared to test 100,000 or more Delawareans each month, including all of those workers are going back to work on the front lines. Those have been on the front lines throughout the 9 months, and to each of those venues doing a tremendous job for our community. Everybody has made sacrifices during this period of time. Some, particularly small businesses and those in hospitality, have made a bigger sacrifice, and that's why our relief grants and financial assistance has been directed to those folks and to those with unemployment, with rental assistance and mortgage assistance needs, and we'll continue to make that support available. And so with that, I'd like to thank again Dr. Rattay for her work and that of her team at Public Health, our partners in the hospitals, primary care physicians, pharmacies, as we get vaccinations and vaccines into Delawareans' arms, and the really important work that we have ahead of us. And then we'll hear from Dr. Bunting about our efforts on the school front. Dr. Rattay?
Great, thank you so much, Governor. So let me start with, as always, areas of concern. And you know what we're seeing is consistent with what the governor just shared is our cases in general are relatively stable, slightly increased. We see a little bit of an increase in percent positives, and that really is a reflection of less testing over the last week or so. But we're really seeing cases across the states, so no particular hotspot that jumps out, but you can see here those in blue are the areas that have the higher case rates, and in red, Wilmington 19801, Frederica, Selbyville, Georgetown, and Seaford had the highest case rates this last week. And what this really shows us is, again, we're just really seeing some general community spread statewide. So since AJ's not with us today, I also want to give him a big shout out on the next couple of slides to really highlight the amazing testing efforts that AJ and many others have been involved in. Hitting 1 million tests for our small state is quite astonishing. And although our testing rates were a little bit lower last week due to the holidays, it's really important that any individual who spend time over the holidays with loved ones not a part of their household, or spent time over the holidays with individuals certainly who had COVID, individuals who are going back into the workplace now, students who are going back into the school setting, which we hope are many, please take advantage of the many testing sites that are available across our state this week. I'm pretty sure, AJ, this is a record of Newcastle, Kent County, and Sussex County testing sites. So again, please take advantage of these testing sites starting the new year, knowing your COVID status. Let me shift gears a little bit. As the governor alluded to, he mentioned a Mississippi study, and really we've all been paying close attention to what's going on in the school setting as it relates to COVID over especially the last 6 months. And this was a really helpful study that the CDC published a couple of weeks ago, where they looked at 400 students in Mississippi who tested positive, 400 students. And what they found was those who tested positive were more likely to have attended gatherings like weddings, parties, play dates, or funerals, but they were not more likely to have attended childcare or school in person. Again, really showing what we've been seeing consistently here in Delaware, across the nation, across the world. We're just not really seeing spread in the school setting. So shifting gears slightly, I want to introduce to you some changes to our My Healthy Community dashboard that went live today. So first, you will see that what used to be referred to as the school reopening dashboard has been updated to instead provide a weekly snapshot or a summary of measuring the level of COVID-19 community spread in the state of Delaware. Now, the previous school reopening dashboard was based on the state's understanding of COVID-19 at the time that it was developed. in August 2020. And we have certainly learned a lot since the summer months, and no longer believe that the reopening dashboard is an accurate reflection of the conditions in schools. In fact, what we saw in November and December, when we had higher levels of community spread, that although there were more cases of people who were affiliated with schools, we did not see more spread in the school setting. And really, that was quite eye-opening. So this community spread dashboard, we do feel is an important dashboard. It provides important information with new case rates and percent of tests that are positive, as well as hospitalization rates. One of the most important things that this provides for us is trends on a weekly basis, so we can see if we're going up or down in any of those key indicators. And then if you click on more detailed data, you can get to, again, a statewide that gives you more information about how much we've gone up or down each in the past week, but it also will show you county level data, which is where I just saw that Kent County has still the lowest testing rates, and Sussex County had the highest increase in cases this past week. So it's important information that we all continue to keep an eye on. But again, we just don't see it as an accurate reflection of conditions in schools. And so what we now have on our dashboard on the on My Healthy Community, if you click to the next slide, you're going to be able to, on our front page, see a tab that says in-person school cases. And by clicking on that, you will get to some new information. Some of this is information that we've been providing Friday in our press releases, and we've been hearing from the public and those in the school setting that they want more of that data. They want more of that data that helps them understand what's going on in the school setting cumulatively and by week. And so what this particular area of the dashboard shows you is either by school district, public districts, charter or private. It tells you the number of in-person contagious cases, and I'll explain that in just a minute, in the past week and cumulatively. And you can see that for students and staff. And over on the right-hand side, you can see the bar charts that are also helpful. Now, let me take a moment to explain what in-person contagious cases are. This is a term we use in epidemiology. So we collect these data already. The school nurses provide this data for us. We use it for infection control purposes. It helps us know, if somebody was contagious in the school setting, helps them identify their contacts and put those people, request those people be in quarantine. So this is data that we already collect. It doesn't necessarily mean, that people got their infection in school. In fact, in our epidemiological school reports over and over again, we saw that they did not get their COVID from school. But it is an indicator of what the schools are dealing with, and operationally, it certainly impacts the schools. So again, this piece of the dashboard shares this information statewide. And then on the next slide, you'll see that we've, per request, we wanted to be able to present more data at the district level, which we're now more able to do, especially on a cumulative basis, since there are more cases as we have gone forward. So when you look on this, you'll be able to find cases by district weekly and cumulatively for students and for staff. You'll see tables on the left-hand side, and you'll see on the right-hand side a bar chart. I do want to make sure that people are aware that some of what you're seeing here, in fact, much of what you're seeing here is a reflection of two major things. One is how long has that district been doing in-person learning? And secondly, how large is the district? And so we'll be providing more information as it relates to district size, as well as percent of cases per number of people who are in-person learning to help level set that. So that makes more sense. But just keep that in mind when you look at the district level data, that the size of the district certainly makes a difference with that data. So with that, let me shift gears to another extremely important topic, vaccines. We're really excited to have be able to launch our vaccine tracker website on My Healthy Community this past week. So if you go to our data website, My Healthy Community, you'll find more information that we're tracking around the vaccines. Now, this page just shows you who are in the different phases. And of course, we are in phase 1 right now. We talked last week about phase 1B. So we're working on plans for 1B, but right now we're really working on getting vaccine to those who are in the 1A category. On the next slide, which is another part of the vaccine tracker, you can see how much vaccine has made it into the state of Delaware so far. So we have for the Pfizer vaccine, we have over 22,000. For Moderna, we have over 28,000. So we have 50,000 doses that we have received in the state of Delaware already. And on the next slide, you'll see the doses that are administered. So we have administered over 15,000 doses in the state of Delaware at this point. I do want to point out that there are several factors in play. First of all, more doses have likely been administered than are showing up on the vaccine tracker due to some reporting issues and delays. And DPH staff are working with partners to identify any bottlenecks and resolve them. But we do know that our vaccination numbers are probably a bit higher than what you see here. Of the remaining doses that have not been administered, we know that over 10,000 of these doses are second doses. So those are on hold right now. Soon they can be administered, but since we just started vaccinating 3 weeks ago, we're not quite ready for most of those second doses yet. We also have about 10,000 doses in the DPH warehouse. Over half of those are going to be administered through our mass distribution or our pods this week that we're doing with EMS and other 1A providers. And the remainder of those that are in the warehouse will be allocated or are allocated for newly enrolled providers, of which we're pleased to say that our enrolled provider numbers, which include hospitals and FQHCs and a variety of other independent providers, is growing significantly each week. And we're getting more vaccine into the hands of providers who can administer this to their patients. So the remainder of this, which is roughly around 15,000 doses, are currently with our health partners who really have been doing a great job with their vaccination efforts. Their ability to vaccinate all staff has been impacted by scheduling and logistic issues over the holidays and some hesitancy by staff to take the vaccine over the holidays, but we anticipate their vaccination numbers are going to increase quite significantly this week. Bottom line is we remain committed to getting vaccine into the arms of everyone who wants one while following the phased allocation plan as quickly as possible. Let's move on to the next slide here, where I want to talk about some exciting news, which is with the federal pharmacy program, we now have already all of our long-term care facilities and assisted living facilities have signed up for this program. 12 clinics or 12 facilities have already completed their first round of vaccination and 171. So the other long-term care facilities are scheduled for these vaccinations. So we're really excited to get this program up and running successfully to protect our most vulnerable populations in the state. So finally, I just want to highlight a really, really exciting event that we had last week, which is an event that was a partnership between DPH and Kent County EMS, DelDOT, the Delaware Medical Reserve Corps, and the Department of Education, where we piloted a drive-through vaccination site at the Dover DMV last week. And we really greatly appreciate DelDOT's assistance with setting up and the traffic flow. And this was a pilot to see if this was a model that we could use for future, we call them pods, but vaccination events where you can vaccinate large numbers of people. And it was really a great success. Kent County paramedics and the Medical Reserve Corps, along with some DPH staff, consistent with the 1A requirements, vaccinated EMS and other first responders with medically related duties, as well as school nurses at the site. And we really appreciate DOE's help with organizing this event. So last week, there were 2 drive-through vaccination events where 580 people were vaccinated, but there's a number of additional events planned over the next 2 weeks, of which we're really excited about. I wanted to show some pictures from that event where you can see some first responders and a school nurse being vaccinated, and you can see our one and only Dr. Lieutenant Governor Bethany Hall Long, who is a nurse, and I had the privilege of getting to do vaccinations with her at that event. We thank you, Lieutenant Governor, for your support of these efforts. And so in closing, I just, again, want to re-emphasize, we know people have questions, and we want to remind people that there is a call center for our vaccination questions, which is open Monday through Friday and even Saturday from 10 to 4. And additionally, we have an email address, vaccine@delaware.gov, for questions. And I know that was a lot, but with that, I'm going to hand it back to you, Governor.
Thank you very much, Dr. Rattay. It's good to see those photographs of yourself and the Lieutenant Governor actually out in the field with the DMV mass vaccination effort for first responders, school nurses there in Kent County. I understand we have another one coming up this week. You know, my job as governor sometimes is to light the fire under folks that work for me at some level on behalf of the people of our state. And with these 2 objectives that we have, vaccinations and getting children back in school, that's the role I'm going to take early this year. That's my New Year's resolution, is to light the fire and inspire all our partners. And we're starting with vaccinations with our normal vaccination partners that we would have in any flu season. So we would normally vaccinate, I think, 500,000 or so doses over a 3 or 4 month period of time. And we've got to have a better throughput even than that as we vaccinate Delawareans with the doses that we get. I'd rather have the problem that we're waiting for more vaccinations from the federal government than we have vaccinations not sitting and waiting to be injected into somebody's arm. And that's going to be our objective. We're going to work through those partners, and they've been great partners, primary care, our pharmacies, our hospitals, and they've already received thousands of doses of vaccines. And we're also going to look at mass vaccinations on the order of the pods that Dr. Rattay talked about at the DMV, other opportunities similar to what we've done over the last several months with respect to testing, and doing it in a way where we're really focusing on those targeted and priority populations, but moving eventually into mass vaccinations of all Delawareans. Same thing is the case on schools and getting our children back in front of teachers. No more important thing that we do in state government than keep people safe and educate our children. And now's the time. We know what we need to do to make it even safer for students and faculty, and to support our educators, to support our administrators and school boards and getting that done starting on the 11th. Dr. Bunting, thanks for joining us today and for all the work of you and your team, John Sheehan, and really pushing on this very important objective.
Thank you, Governor. As the governor mentioned, we had a pause in our attending school on a in-person instructional basis. We wanted, for a variety of reasons, to take a look at what was happening, but the operational matters did inform that pause. And during that pause, members of my team and I were able to meet with each of the 19 school districts in Delaware and representatives from every charter school during the very last 2 weeks of December to hear their concerns and their questions before returning to a hybrid model where students are in school sometimes and sometimes learning remotely. And that was planned and still is planned for January 11th. Each of the meetings was a little different in composition, but generally we met with leadership teams from the district administration and members of the local unions in groups that ranged in size from 4 to 35. We heard a great deal of positivity and immense gratitude for those who have been working so diligently to keep everyone safe and learning during this challenging period. And I do want to echo that thank you to all of our educators for all that they are doing to meet the needs of our students and their families during this unprecedented time. One of our purposes in speaking with them was to find out what we might be able to do as a state to help them feel comfortable and safe in returning to school. We want to thank them for their candor. They really did engage in honest conversation with us because I think all of them are, or many of them, most of them, really do want our students back in school, recognizing that we can best address students' needs if they are with us at least part of the time for several of the days each week. So asking what we could do as a state led to a number of common themes that we can really easily summarize. And so we'll take a look at those. The amazing one was this request for clear, concise, transparent communication. And I think you just heard from Dr. Rattay the efforts that have been made to change the dashboard, to make it more informative, to give graphs as well as statistics, to take care of information that is district oriented and town oriented, county oriented. There's a lot that is there in this effort to make sure we are providing as much information as we can so that people can understand, and not just our school personnel, but our parents and our community members can all understand and be able to share with others what is happening in our schools. The communication is a two-way street, and we really have worked hard on making that clearer and being transparent in all that we're doing with that. That led to the simplified dashboard change and the explanation of how circumstances have dramatically changed since the first dashboard for reopening schools in the fall was put out in the middle of the summer. So thank you to Dr. Rattay and her team for making sure that that information is available and is so clearly presented. Another of the requests that they had to do with the fact that the disease itself, the COVID virus, but also the quarantining practices that we have been putting into place to make sure that we are tracking the cases that we might have, and also making sure that if indeed you have been exposed, you are not going to be able to pass that on to others very quickly. But that has drained some of our really tight supply of substitutes. This is annually a problem in schools, and so we find that challenge is something we're always fighting, but it's been exacerbated this year by, as I said, the quarantining and the actual numbers of cases, which have not been great. But we do see a big impact on what happens in a school on a day when we don't have staff members, or we don't have the cafeteria staff or our custodial staff. So we are actually doing some publicizing on our Join Delaware's website to encourage people to think about substituting even if they've never done so before. And maybe more of our people who in the past have substituted but are a little hesitant this year will feel more confident in coming back and helping in our schools. We really appreciate their partnership with that. Another thing that we heard about, of course, was the curiosity about would there be a vaccine and how would that play out and who would be vaccinated first and in what order and so forth. So amazingly, that vaccine has now come into the state of Delaware. Dr. Rattay outlined the phases that we're going through. Educators are in phase 1B. And so districts and the department are in the process of having conversations about the preliminary structure of plans, and then districts will work with the prioritization once we have numbers and we can make the arrangements for the vaccinations to occur. It's been interesting on the testing front, and that's a great segue to our final slide, because our teachers have been tested since the latter part of the summer before school reopened. They are involved with a vault testing process so that once a month, a quarter of our teachers are done every week, so that during the course of the month, we have had all of our teachers tested again, and that's been very helpful. We also saw amazing efforts to test throughout the community. More than ever before, these AJ's calendars are just filling with many, many, many websites where you can quickly be tested to see if you indeed are free of the virus or you need to be taking the precautions because you had a positive test. So we're really grateful for the community sites. I think that brings a lot of confidence to people to know the numbers that are being tested and the numbers that are not carriers of the disease. But beyond that, we have two other very important things that are happening. We do have antigen testing that is for a wider group of students. We can do this in schools. We can make sure that people have access to that testing. We're beginning to have several schools say that they are willing to do this with our students. It's a rapid test. Of course, the students need to be basically in the facility to do that. It gives you a very quick response, and we can take steps for people who are asymptomatic, and we need to know that as well. And then we have a process that we would go through if indeed we find out that a student, for example, might be an asymptomatic carrier, and we have a whole routine that we go through for that case. And we also have Mako testing in schools. Mako testings are done on a large scale basis. You might, for example, have a day when your students and their families might be able to come in and be tested across the board. So we have a variety of ways of checking constantly to make sure that those that are interacting with our students are healthy and can participate in the types of instruction that we know will be very profitable for our students for the year. So with that, I turn it back to the governor.
Thank you very much, Dr. Bunting. Thank you for the work of your team, to our superintendents and administrators, school principals, teachers, educators, staff, for what they've been doing through the last spring and over the summer, as we fed so many thousands of children in our state into the fall. For those who are back into the classrooms, and those who've been doing remote learning as well, and those teachers who've been doing both at the same time, very challenging for sure. We're moving into a new phase, a phase where there's greater hope, a phase where we're guided by more specific data geographically to the school, knowing that the school environments have proven to be safer than just about any other place, and that we know that what teachers and staff are doing in the schools is the most important thing that we have in state government to do. So this is a major effort of ours, and will continue to be, and we look forward to working with all of you and getting that done and making up lost ground for so many of these children. The thing that really hurts my heart is to think about 6 and 7-year-olds that are learning how to read, that just have been missing that, preschool children, those children with disabilities, those that don't have the kind of supported home that's necessary to really get off to a really strong start And we know if you don't get off to a strong start, your academic career is going to struggle from there on out. That's why we have the third grade reading proficiency goal, #1, and we want to make sure that every child can meet that. Just a reminder before we go to questions of the press, and I thank them for joining us again, about the COVID alert app that you can put on your phone. It does, I think, we've had over 10% of eligible Delawareans who've signed up for the app, and it does help you identify folks' contacts if you test positive. It is anonymous, it's voluntary, and it's a helpful tool. Also know your COVID status. Dr. Rattay thanked AJ Shaw and his team, testing team, and there's lots of partners there for the great work that they've been doing, administering over 1 million tests. Just incredible work beyond my expectation for sure. We set a high bar and they ran right past it, and it's been increasing and will be increasingly important tool, again, as we move to the hybrid and in-person learning for children, for teachers and staff, primarily to identify those positives before they're able to transmit it to someone else. Dr. Rattay and others, Dr. Bunting mentioned the asymptomatic spread, something that we've seen a lot of. If you haven't gotten your flu shot, get a flu shot as well. All the evidence that we have heard from the hospitals of late that they've seen some non-COVID related emergency room visits, some flu related. It's really important that we're having, because of the mask wearing, social distancing, it's been a better flu season, I'm told, than we've seen in recent years. So make sure that you do that as well. And just to reinforce the general guidelines, wear a mask, keep your social distancing, wash your hands, get tested, and download the COVID alert. Protect your neighbors and particularly your elderly family members. Help is on the way. The vaccine is coming. It's going to be a high priority for me as your governor to make sure that all of our partners are working at, as the federal government likes to say, warp speed, getting this objective accomplished. So with that, I know we have media that have joined us on the Zoom call, and we have a few pre-submitted questions. Why don't we go to those questions?
All right, first we will go to Nick Ciolino from Delaware Public Media.
Hi, how's it going, Governor and everyone? Happy New Year.
Happy New Year, Nick.
Thank you. I have 2 questions. The first is for Dr. Bunting. I'm curious how far behind kids are falling in their studies as a result of remote learning, and is there any kind of strategy to catch them up when it's possible to have maybe extra tutoring or something like that?
Nick, that's a good question. At this point, individual schools and school districts may be doing some testing. And of course, there's the informal testing or checks on progress that occur on a daily basis, actually, in classrooms. At this point, we don't have any state data. We're getting qualitative information at times from districts, and we will continue to be quite interested in that. As far as efforts at this point to fill, or we'd rather say to complete the unfinished learning, we're loosely beginning to plan some things, but at this point, the typical ways, for example, extra help in the classroom or in a pull-out fashion, or Saturday schools or after-school programs are not able to be had at this point when our kids are not with us. But we will be watching the progress of students, and we are planning, hopefully, that something might be able to occur during the summer. And so we are alert to that unfinished learning and how we're going to approach it. And it will vary a little bit differently, district by district, charter school by charter school.
All right, thank you. And then for the governor and Dr. Rattay, as far as getting the vaccine out to this first 1A group, are there any challenges coming up, particularly with frontline healthcare workers that maybe are not connected to a hospital, private practices, and stuff like that?
I'm going to just take it in a 30,000 foot level first, and then hand it over to Dr. Rattay, I think one of the challenges just here at the beginning is getting everybody in sync, right? We're going to use the partner networks that have been established in the past. They include the hospitals. There are lots of questions. It's a little different than administering a flu vaccine, timing-wise, data collection-wise. We want to make sure we collect all the appropriate data. We've put our vaccine tracker out there just as it's being developed, and so there'll be improvements to that as well. The focus from my desk will be in doing that efficiently and quickly so that we can move along and meet the needs of our total population. We've got great partners. We've had a couple of really good meetings with our hospital partners over the last 2 days, and I'm encouraged by what I'm hearing. And I want to come back to one of the questions for Dr. Bunting after Dr. Rattay answers adds her part to this question.
Yeah, really I just want to add on to what the governor said. I mean, we're really building on an existing vaccination infrastructure. The hospitals, health systems, primary care providers, pharmacies do a lot of vaccination in our state, about 500,000 flu vaccines every year. So, many of those partners are on board and getting this new process of this new vaccine, which takes a little bit of time, but I think everyone's getting up to speed. But we know that the amount of vaccine that we want to get out there and the speed that we want to get out there is different than anything that we've ever done before. And so the normal channels are critically important. That normal infrastructure is very important, but other partners are stepping up. So we have dentists that have signed up to vaccinate. Veterinarians can vaccinate. We have, a number of different partners, plus these pods or these events that I showed the pictures of the Dover DMV event. We know that there are health partners or folks in the 1A group that may not so nicely fit into a bucket where it may be as easy for them to, go to their employer or the hospital to get vaccinated. And so we do anticipate that a number of folks in 1A and our future phases will get their vaccination in at these events, of which we have a number scheduled, or that we are a number scheduled, and we're in the process of scheduling even more this month to try to catch everyone in 1A.
Yeah, just to go back to the question about additional assistance for students that may have missed some learning with the remote situation. My focus, we're going through budget hearings right now with our budget office, is to identify resources within the latest legislation passed in Washington, D.C. for assistance for education. My understanding is there are resources in there for schools to look to the kinds of things that Dr. Bunting was referring to in terms of additional opportunities to help these children. That's certainly a priority of mine, and I think certainly a priority of Dr. Bunting's and the districts as well.
All right, next we'll go to Sarah Gamard from the News Journal.
Governor and Dr. Karyl Rattay, you mentioned earlier that Delaware has received more than 50,000 doses of the vaccine and has administered somewhere around more than 15,000 of those doses. Why is it taking so long to vaccinate people? Have there been roadblocks, such as finding enough people to administer it, and why is the state not administering it on Sundays and holidays?
Let me just, again, take the 30,000-foot view. That was exactly my question over the last several days with respect to our folks at public health and our partners. And I think the best way to understand it is to look at the breakdown in the numbers. Where are those 50,000? And some of those are being held in reserve, as you heard Dr. Rattay say, and I'll let her run through the approximate numbers for the second dose. Some are moving are waiting in the warehouse to move out this week for a mass vaccination site that's being planned, and some are being held for other mass vaccination sites. I mean, my objective, as I said earlier, is to inspire our partners and our own team to get as much vaccinations out as efficiently and effectively as possible. I'd rather be in the position where we're asking for more vaccines than we're not getting out into arms the vaccine that we have. I'm pretty confident, based on what I've heard, that we'll be able to catch up, if you will, just based on the startup challenges among our partners and internally, and be in that position sooner rather than later. Dr. Rattay?
Yeah. So, first I want to say that we're also very confident that the pieces of the infrastructure that have been stood up and the work that is being done through DPH and our many partners is many things are coming together, and we are excited about that. The 15,000 we know is not a completely accurate number. In other words, we know that there's some underreporting and that some reporting issues as well. And so we are working with our partners to identify any bottlenecks to resolve that. But all of the doses are there's a plan for all of these doses. So, a number of them I mentioned before, over 11,000 of those doses are second doses. So they're not ready for use yet. So they do show up in our numbers, but they're not ready for use yet. We have over 10,000 doses in our warehouse that are going to be used for these mass vaccination events, of which we have a number that we're getting up and running. Half of that amount will be used in the next 7 days with those events. Additionally, the remainder of that is allocated to newly enrolled providers who are ready, willing, and eager to vaccinate their patients. But we also do have a number of doses, approximately somewhere between 14,000, 15,000 with our health partners still, who really are doing a great job with their vaccination efforts. But the holidays have made this a tough way to get started. Logistics are more complicated over the holidays. There's some hesitancy from staff over the holidays to take vaccine, but we really are very confident. They are very confident that the acceleration of vaccination is going to increase significantly over the coming weeks.
So another question that I had is about the plan that the state has put forward for the vaccine. Because the virus first came to Delaware in March, which was nearly 10 months ago, and officials have consistently said that the state can't fully reopen until a vaccine is available. So why wasn't a full vaccine plan, from who gets it first to how it's administered, why wasn't that finalized sooner? Would that not have expedited the current process?
Yeah, I think it's a great question. We do have a plan and we are executing upon that plan. I did mention that, the holidays have created some challenges for execution. Some of the data reporting issues that we're seeing, we are working through. You can't always plan for every single thing you're going to see in execution, but we have a plan. And we are executing that plan, and we're really confident that we are going to get this vaccine out into the arms of people very quickly.
All right, next we will go to Cassie Semyon from WBOC.
Hi, Governor. Hi, everyone. Can you hear me?
Yes, we can hear you fine.
All right, great. Thank you. Happy New Year to all of you. I'm going to ask Governor, I am working, on this story that a lawmaker here in Dover is working on a joint resolution for the General Assembly asking for basically a joint effort to investigate how COVID-19 has been handled in Department of Corrections facilities over this time period after multiple complaints from family members, inmates, and civil rights lawyers. And I just wanted to get your take on this. Obviously, I know you wouldn't have a vote in whether this joint resolution passed, but I mean, I wanted to get your take on how you think COVID is being handled in our Department of Corrections facilities and what you think of lawmakers taking on a attempt to, understand better what is going on through subpoena power and, the right to call witnesses.
Well, I think the Department of Corrections and the Commissioner DeMatteis have done a really good job, frankly, in managing COVID-19 in Delaware prisons. The numbers would bear that out. And I've been very attentive to what's happening there. I've met with civil rights groups around a number of ideas that they've had about releasing prisoners, inmates earlier. I have very limited authority to do that outside of our commutation process. We are not detaining, the courts are not detaining the number of inmates that they normally would. That's frankly creating some issues in some communities, in my view, with respect to the violence that we're seeing on the street. The testing, the mask wearing, the focus that Commissioner DeMatteis has on her staff and on inmates, on quarantining inmates, I think will stand the test of any legislative inquiry. I have not heard from that those legislators directly about that. I would have confidence that Commissioner DeMatteis and her staff will be able to answer the questions and then that any inquiry delivers. We know on a regular basis from family members and inmates that we hear lots of complaints, many of which don't turn out to be accurate. And it's always difficult to sort out fact from fiction. I get that my facts from the commissioner, and I know in any kind of inquiry, legislators would get the facts from her as well. And I know that they've been doing a really good job under very difficult and challenging circumstances. And if you look at the number of inmates that we currently have under our Department of Corrections, it's about 25% lower than when I took office. Some of that is that we don't have jury trials, and so there are not cases moving through the courts. There are inmates or offenders that are not being detained, and a lot of reasons for that. But there are fewer people in that circumstance. We have looked at, as some of the civil rights groups have asked us to do, look at elderly inmates who may have compromised health conditions. We have done that. I don't have the authority to release them early. We've recommended some to the judges that would do that, and there are a number of those, frankly, that I wouldn't be comfortable recommending, nor would the commissioner. But I feel confident when members of the General Assembly see the facts and listen to the facts, that they'll have the same confidence in the commissioner that I do.
You mentioned a moment ago commutations, and that you don't have the ability to make those decisions, but you can make referrals. Is that something that you would push for if COVID continues to be a problem in Delaware prisons?
I can commute a sentence. That is the area that I have some authority. There's a process that applicants have to go through to the Board of Parole, to a committee within the so-called MDT team within the institution, then to the Board of Parole, and they get a recommendation from there. They get a recommendation from the Attorney General's office, goes to the Board of Pardons. If they recommend it, they have to recommend it to me for me to confer a commutation, in which case a sentence can be reduced. I can only recommend the reduction in sentence otherwise, which has to ultimately been granted by the court.
All right, next we'll go to WDEL. We have Amy Cherry and Sean Green. First, we'll go to Amy Cherry.
Thanks so much, Governor. I'm wondering, as you continue to push for a hybrid return to school on January 11th, whether there are plans to allow for increased capacity at restaurants and retail again, and lifting that curfew on restaurants on January 11th as well.
Yeah, one of the things I didn't mention in my opening remarks, which I should, is that we're going to take a look at all those things next week as we see where the data starts to, what the trend is this week. There are certain things that we'll take a really close look at, but we're not kind of out of the woods yet. And we don't know how thick the woods is with respect to those kinds of venues. We have a better feel, much better feel on the school sides because of mask wearing, social distancing, the discipline around all of that. But we'll take a look at those restrictions as well. Right now, we don't have children in school and we allow people to go into bars and restaurants at 30%. And so we're trying to flip that a little bit, as they've done in places around the world where we open schools and be more open on the economy side. But we need to strike a better balance there, and we will look at that through this week and next week.
And next we have Sean Green from WDEL.
Governor, in your letter last month, you had the competition ban on high school sports going through at least January 11th at the earliest. What's the status on that? And how is DPH doing in terms of approving the winter sports guidelines for sports like basketball and wrestling?
Yeah, I think we're still wrestling with that. I'll turn that over to Dr. Rattay. Wrestling, no pun intended, or maybe I should have intended a pun there, I guess. But first of all, I was pleased overall with where fall sports ended up. We didn't see hardly any transmission at all. Dr. Rattay can maybe comment better on that. There were a couple games that were canceled because of some positive cases within certain teams or programs or schools. But I followed pretty close attention to it because the constituents, the people I work for, made sure that I did. And as it turned out, I was pretty pleased with that. A little nervous at the onset of it. Winter sports is another matter. It's indoors, close contact, basketball and wrestling in particular. And so I'll hand it off, pun intended, to Dr. Rattay for her take on that.
So this is an issue that we are grappling with, and a decision has not been made yet. As the governor said, I think we were pleased with the fall season. We really didn't see, we saw some cases, but we didn't really see much spread among sports teams. But we have had some outbreaks among some winter teams, and it's just that indoor setting for contact sports is riskier. So we have some decisions to make around that, and we're not at the point yet of knowing when competition will be allowed for winter sports.
Going back to this issue about controlled environments and non-controlled environments, we have a good example there, I think, and Dr. Rattay can correct me if I'm wrong. The controlled environments of scholastic sports went along pretty well, right? These club tournament sports didn't go so well outside of the competition itself. We had issues with respect to parents and spectators that followed the children into these tournaments and the like, not just here in Delaware, but states around us. The governors talk to one another about that. And it does illustrate the difference between controlled environments and non-controlled environments, particularly where people let down their guard a little bit. They're not wearing masks. They're closer together than 6 feet, not the distancing and the mask wearing that's required at a public athletic event. Dr. Rattay, any thoughts there?
Yeah, I do think that is true. I mean, we really saw our high school sports. I mean, I was incredibly impressed with how well they were run this fall. I have a son who's on was one of the high school teams, and I just was so incredibly impressed with how well organized our youth high school sports were this fall. I think it's more challenging in some of these less formal environments to have that kind of control over the setting, or at least it seems to be.
All right, next we'll go to Alicia Reed from CBS 3.
Hi, thank you. Governor, really quick question about the research that was done and now urging families to go back to class on Monday. Are we sure that students will feel safe as far as we're saying the spread isn't necessarily happening in schools, but outside where they may go to gatherings and such? What is the probability that we will if someone tests positive, catch that virus before it spreads once we have students back in school?
Yeah, so our effort is twofold, right? It's to make venues outside of schools safer and to communicate that schools are safer for those reasons, that they're structured, that children are wearing masks, they're keeping social distancing, and to get everybody to think about the unstructured environments in the schools, you know, when teachers take lunch breaks and the like, when there's comings and goings. And I've been in schools and I've seen that occur very effectively, I might add. And then to be careful with respect to other gathering places that we know are a problem. And we know they're a problem because of the interviews that occur with those who test positive, and the questions around where you've been, you know, over the last several days, where you might have caught the virus and who were you in contact with, and all of that. And if it was just Delaware, it'd be one thing, but it's every state in their region and every state in the country and countries around the world are seeing and saying the same things. Our job is to communicate that to the people we work for, that schools are safer, that these other places can be safer if you do the following things. And so it's both messages that we need to get across.
Thank you.
All right, last we'll go to Tim Mastro from Delaware State News.
Hello. So 2 questions on vaccines. Just first, how much advance notice is the state given just in terms of how much additional vaccine is coming, when that will be, and how does that affect your ability to kind of expedite this process to get it out as quickly as possible?
Yeah, that's a great question, Tim. So the federal government gives us an estimate several weeks in advance of what we might expect of each vaccine type. But then as we get closer to the time of delivery, they give us the real number, which is usually just a few days before it is shipped and arrives in the state. Every time, for the most part, it's either been the same or less than we've expected. And we have seen less a few times, which does make it a little bit more complicated in our to plan. We have to be flexible in how we plan. We're hoping at some point in the future we start to actually receive more than we have planned for. And also it would be nice if we had, many weeks of a projection of what we were going to receive. But, we do our best with the information that we receive, and we get it out to our partners, and we know that they're doing their best to expedite their role in administering it.
Mm-hmm. And so if there is a backlog, if there's just some vaccine that hasn't gone out that's kind of waiting, I know you have the freezers, but is there any expiration date for the vaccine? And does the state have the ability to kind of pivot to, if it's not going somewhere, to be able to ship it somewhere else where it can be used so it doesn't go to waste?
Yeah, we have no concerns about it not being used before the expiration date. It is, I mean, the expiration date is lengthy enough. We have adequate freezer storage, but we intend to get nowhere near the expiration date for these doses. They are going into arms as soon as possible.
And to the other part of your question, my message to our partners, particularly our hospital partners, was to give us a realistic idea of their throughput capacity so we can do just what you're suggesting, and that is divert some of that supply to others in 1A and ultimately into the next group through these pods that we've been talking about. And we're going to do one, I think it's today or tomorrow, in Sussex County for first responders, our school nurses, et cetera, so that we are not leaving vaccine on the shelf. If we have a better idea of that throughput capacity, and it varies, you know, they've got other things that they're doing, the hospitals. They end up having to put staff on the shelf for a period of time because of COVID-19 lots of different reasons. Their hospitals got more patients in it. And so what we need to be react to having that extra so that we can divert it to get into somebody's arm sooner rather than later. And that's something that we're working on as well.
All right, we have one last question. This is pre-submitted from Cody Decker at WRDE. He asked, we learned yesterday that funeral home workers were included in the 1A phase of vaccinations, and there are workers who have not yet received the vaccine. They are concerned about their safety and felt they have been pushed to the back of the line. What is your message to them? And is there an issue with the rollout of the vaccines?
Yeah, I'm happy to take that one. So, you know, I think first it's important to know that for 1A, for phase 1A, there's 70,000 people in that phase. So it's a lot of people. And we've only had vaccine in the state for 3 weeks now. But certainly it is very important to get those who work in funeral services, particularly those who have hands-on contact, the vaccine as soon as possible. We know that partnerships have been created with vaccinators since funeral home directors and several others in 1A don't have the infrastructure in place to vaccinate. Many in 1A can vaccinate themselves and their own staff, but for those that don't, getting them connected to partners is key. As I mentioned earlier as well, you know, for those in 1A who don't have the infrastructure to vaccinate and haven't found a partner to do the vaccination of their staff, we are scheduling pods or vaccination events for those individuals to go to this month.
So I think that was the last question. I want to thank Dr. Rattay again for her work, and in doing so to thank our partners, the hospitals in particular right now, primary care physicians, pharmacies, our nursing homes, and getting those populations, those 1A populations vaccinated. It's a big group. Dr. Rattay, I think, said over 70,000. We've received about 50,000 doses. More than 10,000 of those are being held for second doses, and a significant number are targeted for upcoming mass vaccination events that we're doing. We have two really big objectives as we move into the new year. First, it's great to be in 2021 and put 2020 behind us. I'd rather not think much about it other than to use it as an inspiration for doing better in 2021 and getting our community healthier and getting our economy healthier as well, and getting children back in school. I have every confidence that we can do it. We will do it. And getting more people vaccinated will help us get more children in front of teachers. And that should be our dual objectives and will be our dual objectives. We're going to ramp both of them up significantly and work with our partners in doing that, and working with all of you and setting up pods and alternative mass vaccination sites to be able to use available resources. I suspect at some point we will vaccinate and use all the doses that we get from the federal government, and we'll be asking for more. And I can't wait till we get to that stage. I know we'll be getting children back in front of classrooms, and we'll be trying to accommodate all the parents who want that to occur for their children. We know that we have to have some percentage that are doing remote learning so that we have the space to accommodate social distancing and the restrictions necessary to make it the safer place that it is. We can accomplish these two objectives with your help and your forbearance, and we appreciate everything that you've done in the last year. We wish everybody a prosperous new year, 2021, because it's going to be a hell of a lot better than 2020. Thanks for joining us today.